our phase 2 is complete. We just need to finalize the key messages for the CSR and use that as a springboard for our phase 3 trials. Our phase 2 study showed a 32% reduction in the primary endpoint of disease progression when compared to standard of care, which I think is amazing. And that should be our leading key message in the CSR.
I'm concerned about the wide confidence interval, though. 14% to 51% is a wide variance. And also I'm noting that the treatment effect was diminished in certain patient subgroups.
Good point. The treatment effect remained consistent in 75% of our predefined subgroups that we defined before the trial started. And that treatment effect remained consistent across the subgroup.
I'd prefer it if we emphasize the strong safety profile first. 4.5% of patients experienced treatment-related adverse events. I'm talking about grade 4 adverse events, compared to 13.2% on the standard of care.
Okay. How about this as a compromise then? We lead with the efficacy because I think that is key to emphasize, but immediately follow that with the safety profile messaging you're suggesting as our key second message.
Yeah, that approach works. We have to emphasize the limitations in certain subgroups. Looking at the subgroup of the patients over 75, I think particularly needs to be acknowledged.
Awesome. Hey, Pierbot, could you summarize the key messages from this conversation between me and Dr. Chepi?
The key messages from your discussion with Dr. Chapiga are: 1. Efficacy. The phase 2 study demonstrated a 32% reduction in the primary endpoint of disease progression compared to the standard of care, which is statistically significant. P-value equals 0.03. Only 4.5% of patients experienced treatment-related grade 4 adverse events, compared to 13.2% on the standard of care. 3. Subgroup analysis. The treatment effect was consistent in 75% of predefined subgroups. However, limitations in certain subgroups, especially elderly patients over 75, should be acknowledged. The positive benefit-risk profile supports advancing to phase 3, with special attention to the limitations in the elderly subgroup in the trial design. These agreed-upon messages will help structure the CSR and inform the phase 3 trial design.